Hello, everyone. I'm Clarence Anthony, CEO and Executive Director of the National League of Cities. I want to talk to you about the reality on the ground in cities as we continue to face the COVID-19 pandemic. In communities of all sizes, the threat is growing well beyond a public health emergency. As you have seen all over the news, cities, towns, and villages are being forced to lay off and furlough municipal workers who are critical to the vibrancy and functioning of our communities. This is not only a challenge to individual families and our livelihoods, it's a direct challenge to the fundamental systems that make America great. Unfortunately, the outlook is grim. Our research estimates show that up to 1 million municipal workers could be furloughed or let go soon. Thousands have been already impacted. And the reality is that these cuts to the workforce will mean that our cities, towns, and villages will be less safe, less clean, and ultimately less prepared to reopen. Right now, the National League of Cities is collecting data and real data and stories, your stories from cities all across America. We need to make sure that the leaders in Washington understand the real impact on cities, the faces of the people. This is what our federal government leaders need to hear. Because what we need, what we're fighting for, is direct funding to support the municipal workforce and get our communities moving again. That's the truth. Cities are fighting for their lives right now. Unless we come together and get the funding and support to the front lines where it will make the most difference, our leaders, local government leaders, will continue to suffer, and the residents. Local leaders won't stop fighting for their residents and communities. But if we don't heed the warning signals of the devastating cuts that have already been made, then our nation's economy will be truly in disarray. The next few weeks are critical. Let's stand together and tell our stories to Washington, to Congress, to the President. Let's put a face to this issue. Thank you, and please be safe.